The study, Screening India's Twin Epidemic, surveyed a nationwide sample of nearly 16,000 participants. Nearly half had hypertension or high blood pressure. More than a third had diabetes, and about a fifth had both conditions. Doctors say South Asians are genetically more prone to diabetes, and cases of the disease have been rising in India for the past 10 years. This country has more than 50 million diabetics. The executive chairman at the Fortis Center for Diabetes and Metabolic Diseases in New Delhi, Anup Misra, describes diabetes as a lifestyle disease fueled by urbanization and industrialization.
The indiscretion in the food intake has increased markedly over a period of time. At the same time, the physical inactivity has increased, more mechanization, and also stress has increased. Smoking remains a significant problem, and as well as alcohol.
Dr. Misra says the age-old tradition in India of frugal eating at home is increasingly being replaced with dining out. Those benefiting from India's economic rise have more money to spend on fast food from chain restaurants and from street vendors. The changing urban economy has also displaced gender roles. Many people say female family members used to be responsible for preparing the simple staple foods India has long relied on.
Nowadays, since everybody is professional, even our wives are working, so it will be much more problematic for us to do that.
Consuming empty calories is getting cheaper in urban areas, but cheap snacks like sugared cola and potato chips are also increasingly available in rural areas, where Indians may not have the access to physicians who can diagnose and treat diabetes.
In another 10 years, we'll have the same status in the rural area as far as diabetes is concerned as we see now in urban areas.
As living standards rise and the nature of work becomes more sedentary, the cost of burning calories rises in comparison to India's mainly agricultural past. Longer commuting distances and easier access to transportation mean more sitting around.
In my dad's time, he used to go to office by his bicycle first. So a lot of hard work and physical movement was there. But now we drive a car to our office and we drive back by our car only. So too much of less physical activities are there.
India's government has launched a pilot program to spread awareness about diabetes to bring the disease under control, especially in the countryside. The task is urgent. Doctors warn cases of diabetes could skyrocket by 150% in the next 20 years. Kurt Asian, VOA News, New Delhi.